make it.
Welcome back in. You know, last week we started off Stroke Awareness Month talking with Dr. Bruce Burns about signs and symptoms. And today we have Dr. Bruce Burns joining us once again this Monday to talk about what to do in the moment and after a stroke. How you doing, Dr. Burns?
I'm doing well.
Okay,
Thank you for having me.
According to the CDC, we're talking about stroke being the fourth leading cause of death in the United States. So with that in mind, what are the warning signs for a stroke?
Well, when people have signs of a stroke, we think of B fast. And B stands for balance. That's acutely being off balance. The E stands for eyes, so acute loss of vision either in one eye or both eyes. The F stands for face, so it's facial weakness or facial paralysis. It's acute onset. The S stands for speech, so inability to speak. Some people think about, they say they think of the words, but they can't get the words out of their mouth. And the T stands for time, and which means that when all these symptoms happen, you have to very quickly ask for help and call an ambulance.
Okay, so you say call an ambulance, but some people say, should I drive myself as a transport to the hospital? What do you say?
We say we would like for you to call an ambulance. And the reason for that is when the ambulance comes to you, they can immediately start assessing you as to whether you're a stroke patient or not. And if they are, we have a very complicated system here in Birmingham. That's our stroke system that's modeled after the trauma system and the cardiac system, where we can take that person and place them at the hospital that can best suit their needs and best treat them. On the way in, the paramedic can get IV access. So immediately when we get to the hospital, we can get you to the CT scanner where we can get a scan of that brain to determine if a stroke's going on and that we can treat you very quickly.
Okay. So what are the four types of strokes?
There's multiple types of strokes, but the main one we think about is an ischemic stroke where the brain doesn't get good blood flow. That's about 85% of strokes, and those are the ones we treat with a clot-busting drug that has to be given within the first 3 hours. And then there's hemorrhagic strokes, and hemorrhagic strokes are strokes where you bleed in the brain, and we treat those exactly opposite. That's about a 15% of strokes. And then people think about TIAs, which are transient strokes that go away. And we think of that much like chest pain and a heart attack. It's the warning sign that a big stroke may happen.
Yeah, now some people can be surprised when they're told that they suffered a stroke. So what are some of the tests that they go through to determine that?
The main thing that we do is scan the brain, and that's a CT scan, because immediately we can see bleeding in the brain. And that 15% of the people that have bleeding in the brain, we treat that completely opposite of somebody that's not getting good blood flow to the brain. So that's the pivotal test, is getting that brain scan. When you hit the emergency room, we try to get that done within a few minutes. We try to get that read by the radiologist and a diagnosis within the first 30 minutes.
Hey, good information right there, Dr. Bruce Burns. Certainly do want people to be alert and aware with it being a Stroke Awareness Month. So thanks for joining us again right here on WBRC Fox 6 News at noon.
Thanks for having me.
All right, we'll see you soon.